Good afternoon, dear colleagues. My name is Dalida. I'm a PhD student, and today my presentation is about HIV situation in Kazakhstan. Right now in Kazakhstan live more than 24,000 people with HIV. Approximately 2,000 people are detected annually in Kazakhstan. In order to prevent the disease, every year on the eve of World AIDS Day in the country are held various types of events. The main institute for the control and prevention of HIV is in the Republic of Kazakhstan are the AIDS centers, which consist of two levels, Republican and regional. To date in Kazakhstan we have 31 friendly offices. They are being created at AIDS prevention and control centers in order to reduce the spread of HIV infection and sexually transmitted infections. Friendly offices occupy a separate room in AIDS centers and provide services free of charge on the principles of voluntariness and confidentiality. Diagnostics and treatment of HIV infection in Kazakhstan is available to every citizen and is carried out free of charge. Medical care for HIV infected people is provided on the basis of trust, openness, and confidentiality. In Kazakhstan, there are more than 130 confidential centers. One of the primary tasks of a doctor at the AIDS center is to develop patients' responsibility for their health and increase their adherence to treatment. To achieve this goal, the attending physician, together with a psychologist and nurse of the dispensary department, constantly provides support to the patient, using family resources and such tools as telephone and messages. Kazakhstan is divided into three levels according to the prevalence of these diseases. 100,000 population. There are regions with high HIV prevalence it includes Almaty, Karaganda cities, East Kazakhstan, and Pavlodar regions. Regions with an average prevalence are Akmola region, Kostanay region, and others. And there are low Kızılırda region and Mangistau. Prevalence of HIV infection in the age group. In the Republic of Kazakhstan, HIV is at a concentrated stage. The estimated number of HIV is 24,389 people. 1,758 people with HIV are registered. This data is for 30 of September 2019. The number of men is 57.7%, women 42.3%, and children 2.6%. The prevalence in the age group of 15 to 49 years old is 0.2%. The prevalence among the general population is 0.1%. Antiviral therapy for HIV patients is carried out at the expense of the Republican budget. We monitor the treatment with special laboratory tests that determine the concentration of the virus in the blood. This is called the viral load. The person receiving treatment is under dispensary supervision. He passes the necessary laboratory tests and is examined by a doctor at least once every 3 months. There is an electronic database for tracking cases of HIV infection. There are about 3,000 people who are not taking therapy yet, and we are constantly working with them. The main reason for refusal: people don't want to accept the diagnosis, don't believe that they have HIV infection. This is an important psychological moment. If a person doesn't accept the diagnosis, they will refuse medications. 15 years ago, when Kazakhstan was just starting antiretroviral therapy, the first drugs were toxic and caused undesirable side effects. These myths still remain. Some people refuse therapy because they are afraid that there will be some side effects. Our clinical protocols for the treatment of HIV infection are reviewed every 2 years. If during this time we learn that there are new effective, safe drugs, then of course we will include them. Thus, our patients get access to medicines that are purchased with state money. Kazakhstan has made some progress in preventing mother-to-child transmission of HIV. Pregnant women are tested twice for HIV, and when HIV infection is detected, preventive treatment is prescribed to prevent transmission of HIV infection from mother to child. Also, preventive treatment is prescribed for a newborn. The development of the epidemic progress of HIV infection in Kazakhstan is in a concentrated stage of the epidemic. The spread of HIV infection is observed mainly in certain vulnerable groups to infection of the population. The government's goal is to provide 90% of young people with the knowledge and skills to protect themselves from HIV and access to sexual and reproductive health services in order to reduce the number of new HIV infections among adolescent girls and young women to less than 100,000 per year. Kazakhstan provides information coverage on the promotion of family values and gender equality within the framework of a single media plan and implements social projects aimed at strengthening the institution of the family, promoting family values, strengthening reproductive health, and promoting gender equality. In Kazakhstan, harm reduction programs include needle and serum exchange programs, and the distribution of condoms among key population are elements of a state policy regarding HIV prevention programs. Over the past few years, as a result of preventive measures taken among key population, the following trend has been observed. Here you can see some of them. Currently, measures are being implemented in the Republic of Kazakhstan to prevent HIV cases for 2017 to 2020, which was approved by an order of the Minister of Health of Kazakhstan, dated April 14, 2017. The Aid Service of the Republic of Kazakhstan has formulated the main directions and activities to fulfill the country's international obligations to achieve the goals of UNAIDS 1999. Thank you for your attention. If you have any questions, you can write me. The email is written on my first page. And here you can see some references which I used to prepare my presentation. Thank you. Bye.